Hello, this is Kara Thrasher Livingston with Senior and Disability Services, and I'd like to welcome you to our webinar, recorded webinar, uh, What are Long-Term Services and Supports? And this webinar is required for you if you are going to pursue care coordinator training. So I invite you to just relax and enjoy the webinar. You can always ask questions during the session. There should be a little bubble, if you will, in your lower right-hand corner to tell you how to submit a question. And you can also download a handout. It'll have a little bubble there for handouts. If your device is able to open PDF and store PDF forms, files, you'll be able to open that. If not, then you can just email us and we'll be happy to give you a copy. So let's talk about long-term care services and supports. This is an intro training required for our beginners core care coordinator series. So what we're going to talk about today are the basics of long-term services and supports and some navigation to the website and things like that. This is our Senior and Disability Services website. I'd like to bring it into my screen here and show you it. It's best to familiarize yourself with this. We won't look at all pieces of it, but I'll call your attention to the main features. Our main page here is available from State of Alaska, my government, Health and Social Services, Senior and Disability Services. You can kind of see that right here where it branches off from Health and Social Services. There are 3 columns on this page. On the left, you'll see pictures of our leadership here and different basic information and mission and contact information. There's a link to file a mandatory report or a critical incident report from here. There is information about training that you can see there and different programs and history and things like that that you can click on the pictures and it'll actually bring you right to those programs. In the center is news and updates. So the more recent ones are going to be up here at the top. And then in the middle, you'll have headlines and information going back into history that was newsworthy for the past couple years. So last year or so is up on the front here, but then there's an archive available there too. On the right-hand side, you will see the units that are in Senior and Disability Services, the different teams that are there to implement our programs and services that we offer, the actual programs and offices that SDS is working with to, deliver different kinds of care in the community. A little bar here for providers, searching for a provider, care coordinator agencies, public notices of interest to providers, certification information. If you're going to study to be a care coordinator, you will have to apply for certification. And that is in our next video that we're offering through our core training series. And then a policy memo of interest to all of our providers, which prohibits solicitation of people getting services. And then under of interest, you will see updates about our new computer system called Harmony, approved program forms, regulations, policy manuals, and things like that. We will also call attention to your sign up for e-alerts. If you click on that, you'll be able to sign up and get updated information directly from SDS. We also have archived e-alerts. If you're already signed up, you can actually click on this and you'll go to a long list of all the e-alerts that came out for the past couple of years, and you can search through those. For our purposes today, one of the ones that you'll use the most as a care coordinator will be approved SDS forms. and the different waiver forms and program forms. You can always explore this on your own. We're just calling attention to it with this short presentation. Regulations and related materials, if you ever need to see the most current regulations that are in effect, you can see those here. You can see ones that are newly effective and proposed. Just a note about regulations, all of them need to go through a public comment process. So what you'll usually see is proposed regulations, a period of comment, and then newly adopted regulations. So there are a lot of changes here. A lot of times people think that when it comes to government programs, things never change, but that is not true. They do change, and a care coordinator needs to stay on top of that. So these are some basics to be thinking about while we go through our presentation here too. So I'm just going to bring that out of our screen, and just know that SDS works in partnership with a lot of other state stakeholders, if you will. But we do have our units listed there, the certification information so that you can become approved to be a care coordinator, and ultimately through enrollment to be able to bill Medicaid for that service. You can see your waiver and personal care services regulations and payment rates on the website, approved program forms, and to sign up for e-alerts as we have just indicated. So what does Senior and Disability Services do? We work under a mission, and here's our mission. To promote health, well-being, and safety for individuals with disabilities, seniors, and vulnerable adults by facilitating access to quality services and supports that foster independence, personal choice, and dignity. So it tells you who we are here to help. People who experience a disability, perhaps they are a frail elder or a vulnerable adult. We help people get to the services that they qualify for and that they need. A care coordinator will help do that for a certain population through the waiver services, and we'll take a look at that. So who do we help? Alaskans of any age who experience disability are frail elders, people who need help with activities of daily living due to disability or chronic medical conditions, and people who need help like that which is provided in a nursing home or intermediate care facility. The vision of SDS is choice, safety, independence, and dignity in home and community-based living. And service principles are located on our website. We don't have them in this particular presentation, but they are just guiding thoughts about how SDS and our provider partners will interact with individuals we serve. Mostly about empowering people to make choices, and that people are in fact people first, even though we do, measure certain attributes such as the need for care and medical necessity, and doing assessments to determine need for hands-on help and other kinds of care that other qualified people would do, like a provider. We are serving people, and people are who they are. We reflect our Alaskan communities across the land and provide person-centered care. So how do people find out about services? One of the ways that people can connect, and one of the main ways, and we like to talk about it in our presentations because it's information which is not tied to services of any kind. They simply provide choices for people to pick from. It's called ADRC, Aging and Disability Resource Center. They do have a toll-free number. If a person calls, they will receive information about where and how to get help, and they will have options counseling available, which just means that the person gets educated, if you will, about what services are and what they do and what they might want to think about applying for, not referrals to specific providers, but just choices for that person. They can also be a resource for a new care coordinator if you have questions about what services are available in different communities. So we're here to talk about some things you may have heard about. What are long-term services and supports? What is a waiver? You may have heard about a waiver. What's personal care assistance? What's PCA? How do people qualify? These are just some basic questions that we are going to attempt to answer during this presentation. Long-term services and supports are basically all services and supports that are paid by Medicaid in a state's Medicaid plan for people who need services that are medically necessary to help them because they have ongoing chronic but stable medical conditions. This would be help for a person that's medically necessary, but they're living with chronic conditions. It's not when people have unstable conditions or perhaps they need medical care because of an emergency or an emergent condition. It's not categorized as emergency care, hospital care, um, care from doctors and medical professionals. Some of our long-term services and supports can be provided by people who don't have any kind of professional license. They're trained to provide the care, but they are a home and community-based service provider, a hands-on care provider, to help that person with their care needs during their average everyday life. Um, the person must be eligible for Medicaid and meet level of care as shown by an assessment. SDS assesses people who apply for services, and SDS decides if they meet level of care for the services. So ultimately, people who have these kinds of needs for care have a choice to receive the care through supports at home and in my community. If they qualified for care in a facility or nursing home, they could choose that. They could choose either one, so it's a choice. So what goes behind the waiver? What informs the concept of a waiver? There is much legislation and advocacy around the waiver programs in all states. One of the bigger pieces of legislation that we teach about is called the Americans with Disabilities Act, associated with accessibility for people who experience disability. The ADA was developed because and put into law because Congress had described the isolation and segregation of people with disabilities as a form of discrimination. So it assures civil rights protections to people with disabilities. The ADA made it so that people with a disability have access to all the regular community places, spaces, um, modes of transportation, and forms of communication that anybody else does have should they not happen to experience a disability. So it's a long story about the ADA, but states were told to develop ways to make this happen for people with disabilities in the different communities. And so the ADA is one of the foundational pieces of legislation to create options for supports for people. Another one is called the Olmstead Act, which was from July of 1999. This is a little story of a significant story, but a short one in this presentation of advocacy where two individuals who received Medicaid who were getting support in an institution at the time because there was no legislation that allowed for Medicaid to pay for care outside of an institution. They had progressed in their programs and in their advancement and learning to be more independent, and they wished to move back home to their home and community and have supports to live in the community. So there was no such thing at the time. The Olmstead Act resulted from a lawsuit regarding this that went to the Supreme Court to result in this decision, which meant that states needed to develop a system of community care options for people with long-term care Medicaid. And the wording at the time was about services being appropriate, people don't oppose it, and that the community-based services can be reasonably accommodated. So those statements just meant that all states were ready and needed to develop, or needed to get ready and to develop community options for people who would choose them, so that they wouldn't need to be away from their home and community. If you remember, the ADA in the previous slide said that a person should have access to their home and community, and Olmsted put that together more specifically regarding Medicaid, having Medicaid there as a way to pay for that. So the waiver just means that a person has a choice between getting their long-term care in a facility or nursing home, and getting supports at home and in the community. And the waiver just means that it's the state is waived from having to only provide this kind of care in a facility. Okay. So if a person has a waiver, they must have Medicaid, and they have to have need for this type of care. And they're not choosing care in the facility or nursing home. They're choosing it at home and in the community. So what are the waivers that Alaska offers? ALI, Alaskans Living Independently; CCMC, a waiver for children with complex medical conditions; IDD, a waiver for people who experience intellectual and developmental disabilities; and APDD, for adults who have a physical disability and a developmental disability. Each state can design its waiver program to fit the needs of the people who access the waiver. In all states, oversight of its waiver programs is done through the Centers for Medicare and Medicaid Services, otherwise known as CMS, and CMS authorizes states to use Medicaid in ways that each state proposes through its Medicaid state plan. CMS also provides a federal dollar match for Medicaid, so states like to implement programs through CMS because the state pays part of it and CMS pays the other part. So states can save money and serve more people. And sometimes you'll see choices in different states and in Alaska regarding that concept. How can we serve more people through this co-reimbursement of Medicaid? It is 2018, and this recording was made in January. At this time, Alaska is gearing up to offer a fifth waiver called Individualized Supports Waiver. Regulations are currently in progress. This waiver is for a population of people who experience intellectual and developmental disability as well. It is, again, a choice to receive supports at home and in the community. So our trainings will go over the specifics of these. We just want to introduce to you what is a waiver at this time. Also, to introduce to you, what is personal care assistance? Personal care assistance is usually known as PCA. It's a little bit different than a waiver. A person still needs to have Medicaid. They still need to have hands-on help with activities of daily living or instrumental activities of daily living. SDS will assess the person for this need and decide if the person has these needs based on that assessment. The person does not need to have the same care as that given in a facility. Simply hands-on help with care that is services that are covered under PCS. So what are personal care services, which is what we call them PCS. PCA would be like the personal care assistant, the person, the individual worker. So it's hands-on help with bed mobility, turning over in bed, getting in or out of bed, eating, usually spoon to mouth type eating, locomotion, getting around the house, toileting, transfer between one surface to another, like bed to chair, chair to bed, bathing, dressing, hygiene. And then our instrumental activities of daily living are things that we do to care for ourselves in the home and or community, such as shopping, preparing meals, and light housekeeping. Again, this is a long-term service and support because the person has a stable but chronic condition, which means they need this kind of hands-on help. It's not a facility care or nursing home level of care. It's a little different than that. Personal care services does not require a care coordinator, but waiver services do require a care coordinator, and senior and disability services may implement future programs that are like personal care services, but for people who do meet level of care for the waiver. So these programs will require a care coordinator, but and under a different role. Again, stay tuned to the regulations because, like I said before, things do change with regs and programs, and a care coordinator needs to stay on top of those. And you'll learn more about doing that as your courses progress. So what are long-term services and supports? All services and supports paid by Medicaid in the state's Medicaid plan. Again, it's a partial match from federal oversight and CMS and from the state's monies. So it is for people who need services that are medically necessary to help with ongoing chronic but stable medical conditions, and the person has to have Medicaid, so they are called a Medicaid recipient. There were many other laws developed too. We do not review all of them in this presentation, but just know that states were instructed to develop community supports that worked together through history to help people of all ages with disability and our frail elders. There are school laws like IDEA, there are disability initiatives, centers for excellence in developmental disability. There was the New Freedom Initiative along the way. The Olmstead versus LC was related to the ADA, but all of these laws together are meant to support people, to help them, a person with a disability, live in the community with supports. Okay, so a little bit more about structure. CMS oversees in all states and in Alaska Health and Social Services, which oversees senior and disability services, which works with our provider partners like you are or will be as you serve our recipients, people who are eligible for the services. So our provider partners and recipients are stakeholders. They will also interact with state divisions such as healthcare services or Department of Healthcare Services under Division of Health and Social Services. Public assistance, DPA, where people apply for or maintain Medicaid eligibility, not waiver or other service eligibility, but Medicaid eligibility itself. The Department of Law interacts with everyone, all of us, meaning we are all protecting against Medicaid fraud as we journey through this, whether we're a provider or a person served or SDS or any other entity who is involved along the way. Assisted living licensing is a state office that oversees licensing for assisted living homes. Office of Rate Review helps to develop rates of reimbursement for our community providers through Medicaid and our medical providers through Medicaid. Myers and Stauffer might be familiar to you. There are audits. If you can imagine, Medicaid is a vast program. It basically sort of boils down to being health insurance for people who qualify for Medicaid. And our providers have to comply with a pretty big set of rules and laws. You'll learn more about that in our next sessions that you attend to pursue your care coordinator training. But Myers and Stauffer is a company that the state of Alaska uses to conduct impartial audits of providers and programs. So this is part of the structure of implementing Medicaid. States need to declare an impartial entity that will do audits so that it has audits of internal and external SDS and other state partners and providers. Okay, there are 6 assurances of the home and community-based waiver program. People who apply are given an evaluation for level of care. an individual one, an SDS assessor or qualified intellectual disabilities professional will assess the person, and they will be reevaluated for level of care annually or as specified in the waiver. People have a choice among waiver services and providers if they qualify and choose to engage in it. Services are delivered according to an approved service plan, which addresses the person's assessed needs, including health and safety risk factors, personal goals, which are provided support either through the waiver or through other means. The state does monitor development in accordance with its own policies and procedures, and the waivers are updated and plans of care are updated at least annually or when there are changes in the person's needs. States need to have a system to verify that provider agencies and the workers they employ meet licensure and certification standards such as background check. Certification and compliance conducts all of these activities for the home and community-based waiver and PCA Medicaid agency providers. All providers, actually. Each state needs to identify a way to address and prevent instances of abuse, neglect, and exploitation of vulnerable individuals. All of our waiver service and grant service and personal care service providers and our long-term care nursing home providers, our facilities, all of the programs that SDS authorizes, everyone involved with them is a mandatory reporter of suspected or known abuse, neglect, exploitation, financial exploitation, self-neglect, or undue influence regarding a vulnerable adult, and everyone is a mandatory reporter of child abuse. So SDS has Adult Protective Services housed within it. Office of Children's Services is a separate office, but we work with them to help protect against these under the health and welfare assurance. The state of Alaska is the Medicaid agent oversight to deliver these programs. So we maintain oversight through regulation to make sure that the waiver program is implemented correctly. And the Office of Rate Review is where the Medicaid billing and rates are developed, and our Division of Healthcare Services is the ultimate authority over the implementation of Medicaid overall regarding its billing and its coding and things like that for all of our Medicaid programs. And Medicaid is, like I said, it's a vast program. It covers not only this corner of the world, which means long-term care in the home and or community, or perhaps the facility-based long-term care that SDS also authorizes. The Division of Healthcare Services also oversees Medicaid that is provided by medical providers, doctors, surgeons, behavioral health, medical-based providers, durable medical equipment, consumable medical goods, things like that. Okay, so it's an even bigger program than you think. So basically, this is an introduction to long-term services and supports and where SDS kind of sits and fits with these concepts and programs. Feel free to ask a question in the webinar or perhaps email us if you do have questions, sdstraining@alaska.gov, and you can download the handout from the webinar, or you could email us to ask for that. This is Kara Thrasher Livingston, and I want to thank you for attending and participating in our CCCORE 01 webinar on demand, what are long-term services and supports. Goodbye.